Imagine walking into a hospital in the 1800s. Here you would find filthy conditions, a lack of trained medical staff, and a high mortality rate or a death rate. This was reality until someone changed the course of history, this someone being Florence Nightingale. Today, clean hospitals, trained nurses, and organized healthcare systems are often taken for granted. These advances, though, stem from the efforts of one woman who transformed the field of nursing. As a student who is looking towards a career in this pathway, I have researched Nightingale's contributions and her lasting effect on modern medicine. Florence Nightingale revolutionized nursing, improved hospital sanitation, and laid the foundation for medical healthcare systems, leaving an impact on society. Today, I will discuss 3 major ways that Nightingale changed the world: her transformation of nursing, her impact on hospital cleanliness, and her contribution to public health policies. Let's start with how she transformed the nursing profession. First was her boost of nursing as a respected profession. Before Nightingale, nursing was seen as a low-class position, often performed by untrained individuals and mainly women. She established Nightingale Training School for Nurses in 1860, which provided formal education and training for those wanting to continue to this job. Continuing was her impact of war nursing. During the Crimean War in the 1850s, Nightingale and her team of nurses reduced the death rate by enforcing hygiene protocols, which will come up later. Her dedication and compassionate care towards her patients earned her the nickname the Lady with the Lamp. Nightingale's contributions to nursing were just the beginning. Her work in hospital sanitation saved countless lives. For example, was her advocacy for clean hospitals. Nightingale discovered that poor hygiene and overcrowding contributed to high death rates. She promoted hand washing, which was the main issue, as one nurse or doctor would go into one room, assess the patient, then go to the next, spreading that disease. Second was the proper ventilation, and lastly, sanitation hospital designs, a principle that is still followed today. Additionally, was her influence on global healthcare standards. Governments worldwide adopted her sanitation principles, reducing infection rates in hospitals. Her book, Notes on Hospitals, became a reference for medical institutions around the world. Beyond individual hospitals, Nightingale also influenced public health policies on a larger scale. First was her statistical analysis and healthcare reform. Nightingale was a pioneer in using statistical analysis to advocate for healthcare improvement. She used data visualization, such as pie charts, to demonstrate mortality rates and the importance of sanitation. This was used during the Crimean War. Lastly was her influence on modern public health initiatives. Her efforts led to reforms in military hospitals and civilian healthcare policies. She influenced government leaders to invest in sanitation, reducing disease outbreaks in urban areas. Now that we've seen Florence's contributions, let's summarize why her impact remains consistent today. Florence Nightingale revolutionized nursing, improved hospital sanitation, and influenced public health policies, shaping modern healthcare as we know it. So the next time you enter a hospital, good or bad, hopefully good, take a moment to think about and consider the clean environment, skilled nurses, and structured healthcare system provided. None of this would be possible without Florence Nightingale's visionary work. Her legacy continues to save lives, proving that one determined individual can change the world. Thank you.